This is my student support system. Keep watching, keep learning.
Hello, welcome to my student support system. In today's class, we will discuss about the Survey and Planning Committee. This lecture is in English, and if you want to study in Hindi, just click on I button and you will get link of Hindi lecture. Or you can directly visit to channel My Student Support System. What is Mudaliar Committee? In 1959, Government of India appointed a committee known as Health Survey and Planning Committee, popularly known as Mudaliar Committee. It is after the name of its chairman, Dr. A.L. Mudaliar. The Mudaliar Committee was constituted to survey the progress made in the field of health since the submission of Bohr Committee report and to make recommendations for future development and expansion of health services. The Mudaliar Committee found the quality of services provided by primary health center are inadequate and need to be upgraded. Let us see what were the terms of reference for constituting the Mudaliar Committee. The main three terms of reference were there. Number one, the assessment or evaluation in the field of medical relief and public health since the submission of Bohr Committee report. Second, to review the first and second 5-year plans, especially health projects. And third one is formulation of recommendations for the future plans of health development in the country. Then Mudaliar Committee submitted its reports, and under the report some recommendations were made. Main recommendations are consolidation of advances made in the first two 5-year plans, strengthening the district hospital with specialist services to serve as central base of the regional health services. Regional organizations in each state between the headquarter organization and the district in charge of a regional deputy or assistant director. Each will supervise 2 or 3 district medical and health officers. This organization should be made in the states. Fourth one is that each primary health center should not serve more than 40,000 people so that effective services can be provided. To improve the quality of health care provided by the primary health centers. Then integration of medical and health services as recommended by the Bohr Committee and constitution of an all India health services on the pattern of Indian administrative services. Greatest attention should be given to the care of health of children. Every effort should be made to develop and expand the network of maternity health centers, and the output of lady health visitor and ANM should be increased considerably so that they can provide better health services through the primary health centers with special attention to MCH care. Thank you students for watching such videos. You can subscribe the channel